Hello, my name is Abby Timms, and I have the part 2 of the video about cost containment for the Affordable Care Act. I believe two aspects that could help us dramatically reduce the healthcare costs right now is prevention and also requiring patients to take more responsibility for their care. According to the Triple Solution for a Healthier America, obesity increases the risk of developing conditions such as diabetes and heart disease. The rate of obesity in adults have doubled in the last 20 years and has almost tripled in the last 20 years in kids ages 2 to 19. Without big changes, 1 in 3 babies born today will develop diabetes in their lifetime. Average healthcare costs for someone who has 1 or more chronic conditions is 5 times greater than someone without any chronic conditions. Chronic diseases account for 3 out of every $4 spent on healthcare. That's nearly $7,900 for every American with a chronic disease. The CDC also states that in 2010, heart disease cost $315.4 billion. Diabetes in 2012 cost $24.5 billion. Obesity, $147 billion in 2008. Economic costs due to smoking, $289 billion. Economic costs from drinking too much alcohol, $223.5 billion. The CDC also states that 52% of adults did not meet the recommendations for physical activity. 47 have major risk factors for heart disease, including stroke, increased blood pressure, and uncontrolled cholesterol, are current smokers. 42 million adults in 2012 smoked cigarettes. I believe that we need to require patients to take more preventative measures, and an example of this is the Center for Healthcare Strategies proposed an idea that both incentive and prevention requires patients to take responsibility of their own health care. And this is done by creating health savings accounts, co-pays and premiums, and healthy behavior awards and incentives. An example is in Michigan has health savings accounts requiring Medicaid recipients to pay 2% of their income into these health savings accounts. So for example, if you made $12,000 a year, you would put $20 a month into this account. And out of this account would come co-pays, which would typically be about $1 to $3 for outpatient services. And the way they incorporated prevention into this is they offered discounts for patients who are willing to do health assessments with their physicians. And other states have adopted some of this by offering incentives for smoking cessation, blood sugar control, and weight loss. I believe by incorporating both of these things, we can dramatically reduce the cost of health care and promote a healthier lifestyle. As for the 3 things that I've learned throughout this semester, I've learned more about family roles and how they affect families and their health. I've learned many different styles of communication techniques and also learned to recognize the many aspects of dysfunction. I believe these will all be incorporated into my future role as a nurse practitioner by understanding families more and realizing how heavily it weighs into also their physical health. Thank you.